So this is the first section of the heart. We're gonna talk about pretty much the anatomy of the heart, vascular supply. Basically, what do we know about the anatomy of the heart? Because most of you guys already know. So how many chambers are in the heart? Chambers, there's a total of 4 chambers, right? The heart, what are the bottom parts? What is this part right here? And what is this part right here? So what is A and what is B? That's called the apex. What is this? That's called the base. So apex and base of the heart. The heart has how many ventricles? 2. How many atriums? 2. How many atriums are on the right? How many atriums are on the right? 1. How many ventricles are on the right? And the same ones are on the left, right? Got it. So it's basically the main anatomy of the heart, like really basic anatomy of the heart. We also are going to talk about the vascular supply. So what supplies the heart with oxygen and nutrients? Now inside the heart we have chambers, right? And these chambers, they're filled with blood. So inside here you have the blood. You have the ventricles and you have the atriums that are filling with blood, correct? Now the heart itself, it is made out of a muscle, and that muscle we call it the myocardium. The muscle of the heart, all it does is just contracts and relax, contracts and relax. But these muscles, they require oxygen and nutrients as well. And that oxygen and nutrient is given by the blood flow. Now, the blood inside the chambers are not used. That means that blood, it goes in and it goes out, but the muscle of the heart does not use any of the oxygen or the nutrients. So oxygen and nutrients to that muscle that is constantly working comes from another vessels. So where are the vessels that gives nutrients to the myocardium? So the vessels are going to be either the left or the right coronary arteries. Okay? So left or right coronary arteries. So the vascular supply is going to be the coronary arteries. What is the pericardium? Peri means what? Around. So the heart has layers protecting the heart itself. So there are 2 types of layers around the heart. One that covers lightly on the surface of the heart, we call this the you should know this from 2085, guys. You remember what was that? You have the visceral. You guys remember his name? And parietal pericardium. In the middle, like this space right here, it was called the pericardial space. And again, I covered this on 2085. Okay? If you don't remember, that's what you need to know. The space, what's going to happen? As the heart gets filled with blood, right? So imagine this is the space. As the heart fills with blood and your heart dilates, this is going to move in. So that means that this line is going to become somewhere around what? Here, correct? So all this will disappear, and now your heart will expand all the way to here. Does that make sense? So now the pericardial space is going to be reduced up to a point that is you almost are not going to see it. Okay? So it's not a true space, in other words. So far so good? Okay. So that is the visceral part of the pericardium. That is the parietal part of the pericardium. Your heart itself. So let's talk about the heart. You can see here that it creates some sort of a chamber in there, right? And there is the heart itself in there. Can you see that? Now the space between here and here, what do we call that space? That space is made by whom? What is this? That space is actually the muscle of the heart, correct? And that muscle is known as the, what do we call that muscle, guys? The muscle, we call it the myocardium. Everybody got it? That myocardium is the one who's going to get the oxygen and the nutrients from either the right or the left coronary arteries. So far, so good? Okay. Now, when you looked at what is in this chamber, what is this chamber supposed to be filling with? That chamber is supposed to be filling with what, guys? With blood, right? You're right. The oxygenated blood, if it's right or left. So in this case, I'm not going to make anything, but most likely these seems to be like this is towards like the left side, but this is like the back of the heart, right? So this is like the back of the heart. Anyway, this chamber, the whole point is that this chamber is filled with blood, correct? Now there's a lining inside. So if we get this piece and we take a section of that piece, you'll be able to see that you have these parts, right? In here is where you have the blood, right? So in here is you have the blood. That means, sorry about that. That means that this part right here, so this portion right here, can you guys see that? That portion right there is known as the what? Endo. Endo what? Endocardium. This section right here, the one that you name, which is the muscle, is called what? Well, we already call it, right? That is what? The myocardium. And the outermost is called what? Epicardium. So you have everything is cardium, endo, myo, and epicardium. Those are actually all the layers of the heart. So these three right here, we call it layers of the heart. So far, so good? Okay. Now, on top of those layers, then you have your pericardial structures, which are what? The visceral, the pericardial space, and the parietal layer. That's going all the way from the inside to the outside. Can you guys see it? I need your feedback. If not, I would have moved forward. All right. So, chambers and valves. We already said that you have how many chambers? Chambers you have? 4 chambers. Okay. How many valves do we have? How many valves do we have? Valves, well, we have 2. What are they? So valves, we have 2. 2 valves where? 2 on each chamber, between each chamber, right? So that's called the AV valves. AV stands for atrium and ventricular valves, correct? The book calls it AV valves. So far so good? Now these AV valves are, of course, what is the word said? What are AV valves? So if the AV valves are atrioventricular, that means that what? That they're between the atriums and the ventricles. Here we go. So, is there any other way that the blood can go out? What do you guys think? So blood enters the heart, one end, it gets out the other way. Do you have an aorta or do you have a pulmonary? Do you have aorta or pulmonary? Yes. So this valve that you told me is between the atriums and the ventricles. There's need to be a valve now between the aorta and the pulmonary. So the total amount of valves that you have, so you have 2 AV valves and you have 2 semilunar valves. What are the semilunar valves? I'm going to give both of them to you right now, right? So we have a total of 4 valves, correct? So the 2 AV valves, finishing what we started, the one in the right is called the what? Tricuspid. Why do we call it tricuspid? Because it has 3 cusps. When you look on the top, that's what you see, like 3 fists. 3 fists right here. Whenever the valves open, guys, look here in the back. Whenever the valve open, it goes like this, and whenever the valve close, it goes like this. That's what we call it tricuspid, because it has 3 cusps. Now, there's another valve which is called the mitral, or the other name for it is bicusp or bicuspid. That means that what? That it has, instead of 3, it has what? 2 cusps. Now, for the semilunar valves, we call them based on where they actually are found, and that is what? They are found either on the aorta, and what else? And pulmonic, correct? So we call both of them what? Aortic and pulmonary valves, right? Or pulmonic semilunar valves. So those are the valves for you. Any questions? Okay. So we're also going to talk about the blood through the heart. So what goes first, what goes second? We're going to do that now. We're going to talk about the action potentials in the cardiac muscle, and we're going to describe the conduit system of the heart. It means your pacemakers, right? The SA node, the AB node. So let's go into them. That was just the plain introduction, guys. Okay. So here's what we need to know. The first thing is that their cardiovascular system is pumped by one organ, and that organ is, what is the name of that organ? The organ that pumps the blood, guys. What's the name of it? The heart. So the heart connects both the pulmonary circulation and the systemic circulation. You guys get it? So there are 2 circulations which are connected by the heart, and the heart works as the main pump for these things. So the heart is, again, it's a closed circuitry, right, that connects both the systemic and pulmonic. It actually contains blood vessels, which are arteries, veins, and capillaries. Anything that is called an artery, that means the blood flows away from the heart. Anything that is called a vein takes blood back towards the heart. But as most of us know this, then what's happening of the arteries? Most of us know that the artery is something that transports what? High content of oxygen. And veins, high content of CO2. This is the true definition, guys. Okay? Arteries, again, blood away from the heart, and veins carry blood towards the heart. Okay? That's the true definition. So what is the location of the heart? Well, it is on the superior surface of the diaphragm, because your diaphragm is supposed to be somewhere around here, right? It is left of the midline, because again, your midline is somewhere around here. So it's more towards the left side of the body. And it's anterior to the vertebral column. You guys know that the vertebral column is all the way to the back, right? It is posterior to the sternum. So in other words, it's protected by your rib cage. Okay? The whole purpose of the heart working as a pump is to push blood throughout the whole body, and with it, it pushes oxygen, nutrients, right? And it moves as well the waste product, which is the CO2, right? Plus all the different ions that your body doesn't use, correct? And that is able to perfuse the blood, okay? And that oxygen through the whole body, okay? So blood flows from the heart to systemic circulation, right? Once it becomes oxygenated in the pulmonary circulation, correct? As blood moves to each individual of the tissues and cells, oxygen gets perfused, right, into the tissue, as well as some of the nutrients, they move into the tissue, correct? When the tissue uses the nutrients and the oxygen, the tissue gives you, as a byproduct, CO2, which comes back into the venous circulation and gives you waste products as well, which comes back again. Now, please know that gas exchange occurs only where? On the lungs, all right? And here is the circulation of the heart. Mainly, what are we seeing? Well, we're seeing that as blood goes in here, every single blood that returns to the heart enters through either superior vena cava or inferior vena cava. That's where all deoxygenated blood enters. Also as well from the coronary sinus or sinus venosum. Sinus venosum. So three things that enters the right atrium, and those three structures will give only what? Deoxygenated blood. What do we call all the blood that enters the heart? All the blood that enters the heart, so everything that comes from here, this is called preload. What is preload? All the blood that enters the heart. Everybody got that? So what are the three structures that take deoxygenated blood into the heart? Superior vena cava, coronary sinus, and inferior vena cava. Okay? And we call all that total amount of blood, we call that preload. So that's the blood entering the heart. And of course, that blood is what? Has a high content of CO2, right? Deoxygenated, and of course a low content of oxygen, because still some of that blood can still have some oxygen, right? But most of it is deoxygenated. So as blood goes from the right atrium to the right ventricle, right? Now it moves all the way here into the right ventricle. It needs to go through a valve. And that valve, we said that this valve right here, the valve that exists in here, it was known as the what? AB valve, correct? So if it's on the right, we're going to call it what? Tricuspid valve. So the tricuspid valve is going to open and allows the blood to go from the atrium into the ventricle. And that's when, of course, when the atrium is filled with blood, right? Then the pressure pushes the valve and the valve opens. So when the valve opens, what's going to happen? Now, blood rushes from the atrium into the ventricles. As blood rushes in, it's going to fill the chamber with blood, correct? Now, understand, as we mentioned before, that the inside of that chamber was known as the endocardium, correct? So as that blood fills the chambers, is pushing on the endocardium, is pushing the myocardium, and it's also pushing the outermost part, which is the what? Epicardium. What is happening to the heart at this moment? The heart is doing what? Expanding. The heart is expanding, right? It's getting filled with blood. So as blood rushes in, what happens? Well, the volume of blood in here is going to increase. And the pressure, it increases or decreases? Why does it increase? Why does it decrease? What did I just told you? A piece of information that I gave you. That the heart was doing what? So if the heart is expanding, the pressure should not be bigger. the pressure should be pretty much about the same or low. Does that make sense? If the heart would not be moving, then the pressure is going to be harder. Does that make sense? So since the heart is compensating, right? Is compensating, so it's getting bigger, then the pressure should be decreased. So that means as the heart dilates, okay, as the heart dilates, the volume, there is an increase in volume, and there is a decrease in pressure. Where is that? At the level of the ventricles. You guys follow that? Okay. Now that's of course during what? Diastole, right? Now, at the same time that is happening on the right side, something else is happening what? On the left side at the same time. So what is happening at the same time on the left side? Well, you have that whatever blood was oxygenated here, right, in the lungs, is returning back from the lungs all the way here, correct? I'm not even talking about any names of vessels, right? So that blood now fills the atrium on the left. As the atrium gets filled, then of course it's going to go to the, opens up, and the left ventricle now it gets filled with what? With blood. And the same thing happens, of course, on the opposite side at the same time. What happens? Increasing volume and decreasing pressure, both on the right and on the left. Okay? If they happen at the same time, what are we going to do? We're going to do nothing. That's the problem. I mean, that is the reason why this thing works this way, right? Now, all the blood that enters here, let's say, for example, if 5 liters of blood enters the heart, how much is supposed to come out? Hopefully 5. Because if not, where did it went? Correct? I mean, not everything at once, but if 5 came in, 5 have to leave. If not, that means that you have a ruptured heart. I mean, the heart is, throwing the blood outside, right? Into the outside, right? Now, 5 liters, that means that is the same amount of volume that is going in both ventricles. We call this what? Isobolometric. Sorry about that. Let me make that bigger. So isobolometric relaxation. And you guys understand why we call it isobolometric relaxation? Iso means what? The same amount of volume. I mean, iso means, the same, at the same time. Volumetric means what? Volume, right? And of course, the metric part is the same, the same dilation of the heart, right? The same accommodation for the ventricles. So, whenever both ventricles are filling with blood, the volume increases, the pressure decreases. We call this isobolometric relaxation. Everybody got it? Guys?
Wait, isobolometric is not the 5 comes in, 5 comes out, right?
No. The reason why I did the 5 is you understand the volume wise.
Yeah.
Iso means at the same time, volume is the amount of blood. It doesn't have to be 5. 5 is just a number that I put up there. It's not even real. That's 5 liters of blood is like too much blood in the heart. But it's just a number. So you understand that whatever comes in the right needs to get out of the left. So that's the volume. So it deals with the same volume, both the right and the left. Metric is because both of the right and left ventricles are supposed to do what? Be compliant, right? They have to at the same time that they can dilate. And again, this process occurs where? During systole or diastole? Diastole. Okay? Normally, what is your systole and what is your diastole? What are the numbers of systole and diastole? Systole is when the heart is contracting, right? And that's going to give you a bigger number. And diastole is the lowest number. That's when your heart is relaxing. So there's less pressure. Didn't we see that there's less pressure there? So normally the new one, it's 110/70. It's not new. It's been there for about 15 years already. But that's the normal blood pressure. That's what you want to be. If you have anything higher than 110, if you have 120/80, which used to be the norm, nowadays is considered to be a risk on the future for hypertension. Right? So far, so good? Okay.
For the blood pressure, when I looked it up, it said that it was anything lower than 120. It wasn't necessarily 110.
Well, yes, you're right. But the norms for a normal individual, a normie, is 110/70. Anything lower than that, and the reason, where did you look that up?
I just looked it up on Google, and every website that I clicked said the same thing.
Right. So that's the problem about Google, and that's the problem about website. It's not a text that is being reviewed. Although I don't disagree with it at total 100%, but understand this. If you have a patient who has 90 of systole, okay, and about 40 of diastole, you need to consider that if that is not the normal in that individual, then that patient is about to crash.
Yeah.
Because anything less than 90 and anything less than 40, you're talking about a shock. That means all the blood vessels are dilating and the person cannot maintain or cannot regulate blood pressure.
Yeah, I don't know, because I work at the hospital and they still consider 120 overweight. They don't use the 110.
Okay.
So that's why.
So this is what you're gonna do. Go to the New England Journal of Medicine. And everybody in the hospital should know what that is. And in the New England Journal of Medicine, of course, it's from England, that's a stipulated diagram. Okay, and for most of the new texts of medicine, they're coming out to be a 110/70. Okay, that's where I got the information from. So, let's go over the heart. So we said that these three structures gives blood to the right atrium and then goes to the tricuspid valve. Blood moves all the way into the right ventricle. That's what we accommodated, right? From there on, where's the blood gonna go? Well, all that blood on the left side of the heart, all the blood on the right side of the heart is going to be what? So all the blood on the right side of the heart. So let me just draw a heart really quick here because I put too many things in there. So all the blood on the right side of the heart is what? Has high content of CO2. Now, what do you want to do with that CO2? Do you want to keep it? No. So what do you need to do? Get rid of it. So where's that after the right ventricle? What are you going to send it to get rid of the CO2? You're going to send it to the lungs, right? So what is the blood vessel that sends it to the lung? We call it the pulmonary trunk. That pulmonary trunk then is going to split into both right and left because you have both lungs, right? One on the right, one on the left. So we're going to call this, one is going to be left, or towards this side on the back, right pulmonary artery. I know it's blue, right? But it's pulmonary artery. Why? Because blood is going away from the heart. So as blood reaches the lungs, then the oxygen is going to move from the CO2 is going to move from a high concentration to a low concentration, and the oxygen that you're breathing in is going to move from a high concentration to a low concentration inside your lungs. And that oxygen now is going to go in the blood. Does that make sense? So, in other words, oxygen and CO2, they move always from a high concentration to a low concentration. So far, so good? So, we call that what? This is the term in 2085. We talked about in 2085 about diffusion, osmosis. I remember that stuff. All right, so please find out what is from a high concentration to a low concentration. All right, the movement of solutes from a high to a low concentration. In this case, we're talking about gases, right? So it doesn't apply because it's not solutes; they're gases. So gases go from a high to a low concentration. Now, in this case, as the oxygen comes back in, it's going to go from the lungs all the way into the left atrium. When it goes into the left atrium, it's going to go through the pulmonary veins because it's taking blood back to the heart. So the pulmonary veins is going to get the oxygenated blood. So the oxygenated blood already from the lungs it's going to get into the left atrium. And from there on, when the left atrium gets filled, it's going to open the mitral valve, and then the left ventricle is going to start to do what? Fill with blood, correct? Again, both of these things, all of these things are happening at the same time, both on the right and on the left. So far, so good. So that means the left side is always going to have a high content of O2. Everybody got it? So once the left ventricle fills with blood, right, we're being in what? In a diastole, correct? What do you need to do now to push that blood outside? Your heart is dilated. What do you need to do? You need to go into, oh my God, sorry. You need to go into systole, right? So systole is the next event. So systole, what do we do in systole? We see the same thing but opposite. Means isovolumetric what? What do we saw in diastole? This was diastole, right? So isovolumetric contraction. Everybody got it? So this is again in systole, this is in diastole. What happens to the volume and pressure during the contraction of the ventricles? What do you think is happening to the volume? So during contraction of the ventricles, the semilunar valves, both the aorta and the pulmonic, are going to open, so blood can leave. So what's going to happen to the volume? The volume of blood will decrease, and what happens to the pressure? The heart's not getting bigger, now it's getting what? Smaller, tighter, right? So the pressure should do what? Increase. Everybody got it? Any questions? Simple enough? Okay. So, what are the parameters that we actually looked at? And again, I'm skipping a lot of these things, right? Oh, sorry, before going to the parameters. So once your contraction takes place, again, your book is always going to refer towards the left ventricle, right? Why the left ventricle? Because the left ventricle is the one that has to send the blood from there all the way out of to what? To the aorta. Okay, so left ventricle always shoots the blood out of the aorta. And you can actually see the pathway of blood here, right? In the right arrow. So, normally, what is your blood pressure? What is your normal blood pressure? You said 120 over 80, right? So let's take that number now. So if I have 120 over 80, that means that the blood pressure, the way that you do it is because you're measuring the pressure on where? On your brachial artery, right? So when you press on it, that's the amount of blood that is flowing. When the heart is contracting, that's the amount of blood that is flowing and pushing the vessel to the outside. Does that make sense? What is diastole? That's the amount of blood that is, the amount of pressure that is exerted by blood when your heart is doing what? Relaxed. Right? So one number is bigger, the other number is smaller. Does that make sense? So as you move forward, then what happens? Well, if through systole you need to get a greater pressure, which one does more force? The right or the left? The left deals with more force. The pulmonary pressure is about 10 to 15. Right? You don't want anything greater than 20. That's the pressure on the lungs, compared to 120 on the systemic, correct? Especially on your arm. Does that make sense? So the left does what? The left side of your heart deals with, so the left side of the heart deals with what? Greater pressure. So if it has to deal with greater pressure, Who has more muscle mass? Individual who does 5-pound dumbbell or individual that does 65-pound dumbbell? 65, that's common sense, right? The same thing, guys. Who puts more pressure up? The right or the left? So which one has a greater or thicker myocardium? The left. So that means that deals with high pressure. That's why the myocardium is thicker. So far, so good? Between the right and the left, who pushes more blood? Who pushes more blood? Right? We have left. Do we have anything else? Why do you say right?
I say left because it has to push up.
If 5 liters of blood comes in, same example, even though it's not real, how much blood needs to come out? So right and left are equal. The same amount of blood is being pushed. Whatever is pushed by the right, it should be pushed by the left. Does that make sense? If the left pushes less, that means blood is staying within the heart, or vice versa. Is that clear? As you push now the blood outside, I'm going to do this with someone. So as you push the blood outside, what is happening? She's exerting on top of my hand 120. Exert 120 on me. Push. She's exerting 120. What is this hand? This hand is what? The aorta. That is pushing because, again, she has an arm, and the arm is, I have 120. And this is the rest of the aorta that is coming out of the ventricle. Come. That's 120, sorry. So 120. That means for the blood to get out of the left ventricle, what do I need to push? 110? If I push 110, what's going to happen? She's pushing 120, I'm pushing 110. It's not getting out of my heart. Okay? She's pushing 120, I'm pushing 120 with my left ventricle. Is it moving? No. That means that the pressure exerted by my left ventricle needs to be greater than whatever is in my arm, in this case, correct? Or in the systemic. That means I need to push at least over 120. Does that make sense? So the blood can move forward. That's why there is a lot more pressure on the left ventricle. So far, so good? Now, since that is a closed circuit, means the arteries are connected with the veins at the capillary level, whenever I push, and I'm going to do this with both hands, whenever I push on the aorta, push me, give me the other hand, it's a closed circuitry, right? We all connected. So whenever I push in one hand, what's going to happen? What I should receive in this one is going to push back. Does that make sense? So if I push blood forward on the aorta, she's going to give me blood back on the venous system. Does that make sense? So the more I push, the more blood should I get back, correct? But once I stop pushing the blood, what I get back? I'm done. Give me 2 hands. I'll let her fight. So this is my aorta, right? She's pushing towards me. If I push in systole, which is once, right, over 120, and then I relax, what's going to happen? You see how she came back? That means that the blood is going to come back towards the aorta and trying to get inside the left ventricle. Does that make sense? Because it's a closed circuitry, because you still have pressure. That means that that blood is trying to get inside the left ventricle, is known as the afterload. So we talked about preload, and now we talked about what? Afterload. Do you understand what afterload means? Now, why is that thing is not getting inside my left ventricle? I believe because we have a valve, right? Aortic semilunar valve. If the valve is working, then you have nothing to worry. That blood will stay there. Whenever you regenerate more pressure on the left ventricle, you push that blood backwards. Does that make sense?
Wait, so afterload was blood trying to get back to the left ventricle?
Blood trying to get back to the heart. Yeah. Like after you go through systole, after you contract your heart, when you relax, that's the blood that is trying to get back to the heart. That's your afterload. Preload is all the blood that enters before a contraction of the heart. So now you understand the difference between preload and afterload, right? Which is the backwards of blood. Backward movement of blood, right? So far so good? Okay. Now, during that backward movement of blood, at the branch here, so at the ascending aorta, there are two blood vessels that arise from here. One is going to be the right coronary artery, and the other is going to be what? The left coronary artery. Do you guys see it? So one is going to be the right coronary, and the other is going to be the left coronary artery. Once that afterload comes back in, and it can get in because you have what here? What do you have there? All right, let me change the color. I don't know why this thing is not working. Sorry guys, I don't know how to do this. I'm still new at this thing. So what do you have here? Oh, even worse. You have the valve, right? That valve is going to maintain closure, so blood cannot ever get back to the heart. Okay? So that means that the blood is going to go do this. Does that make sense? Because there is a valve here that is closed, correct? That means that their blood is going to move now down both the right and the left coronary arteries. Okay? What does this mean? That both right and left coronary arteries will only be filled with blood when you are in systole or diastole. So both right and left coronaries fill during diastole. Everybody got it? It doesn't happen during systole because the pressure is what? About 120 or even greater than that. Can you turn a sharp turn at 110 miles per hour or 120 miles per hour? No. That's why it fills during diastole. And at that moment, when the heart is relaxing, is when now you have your perfusion of that blood and oxygen, right, into the myocardium when the heart is relaxed. So far so good? So that's about the whole physiology of the heart, which you really need to learn in one single slide. I do apologize for it, but it's a summary. We're gonna go over it again, don't worry. So we have again, the main thing, whenever you have too much preload in your heart, what hormones will be activated in the heart to prevent this from happening? When you have too much blood entering your heart, right, what hormones do you have to prevent this from happening? AMP and BMP. So AMP and BMP, whenever your preload is increased, what is preload? Again, the blood that is entering the heart. Whenever you increase in preload, your heart, your atrium is going to produce both AMP and or BMP. And by doing so, it allows your kidney to get rid of most of that water, right? The plasma of the plasma portion of the blood by peeing it out. So, how do you know there is a dysfunction? Dysfunction means that it doesn't work, right? When your AMPs and BMPs are about 200, okay? That means that you have a heart problem because your AMPs and BMPs are not supposed to be that high. In other words, your body's working twice as much. Okay. Normally, AMPs, they work as what? Diuretics, right? Or to increase diuresis in your body. You're gonna pee that out, and your blood pressure should do what? Decrease. So far so good? So that's endocrine and the heart. Okay, here we go. Let's go easy part. Ready? Let's do this. What are the three things, right? What are the three structures that blood enters on the right atrium? Superior vena cava, inferior vena cava, and the coronary sinus, right? Or sinus venosum. So those are the three structures. Blood enters the right atrium. That's deoxygenated blood, low amounts of CO2, high amounts of CO2. And then as the blood fills in here, the pressure increases, and now you're able to do what? To send blood through the right ventricle. Everybody got it? Now let's do a couple more things in the anatomy before we move forward, because I'm pretty sure everything else you guys know. What allows this valve to keep or maintain itself closed? These structures. Do you see these little cords? Do you guys see those? So these are known as chordae tendineae. And these are called papillary muscle. So what gives the structure to the valves? The AV valves, right? The chordae tendineae and the papillary muscles. If by any chance you have an infarct, a damage of either the chordae tendineae or the papillary muscle, that means that this valve can now do what? Open. And if you think about it, okay, when blood, let me erase this a little bit so I can draw something here. When blood reaches here, we said that the blood fills, and what's going to happen to the volume? As the blood enters here, what happens to the volume, guys? Volume increases and pressure decreases, correct? That was during what? Diastole. What happens during systole? Volume decreases, but the pressure does what? When the pressure increases, don't you think that this blood is going to push up in the valve that is closed? Why doesn't the pressure open the valve up? Because the valve is attached to the chordae tendineae and the papillary muscles. If you break any of these things, right, either the papillary muscle or the chordae tendineae, then you're going to have a backward movement of blood. What is a backward? Well, something that is not forward. A backward movement of blood means that blood, instead of moving forward to get oxygenated, is going to go move backwards to become deoxygenated. Is that something good or bad? That's definitely bad. So whenever you have a damage of these things, right, we call this a murmur. What is a murmur? A abnormal heart sound. Right? So far, so good? Now, the rest of it is easy, right? So, blood fills in here, it moves all the way up to the pulmonary, what? Pulmonary trunk. Then once it goes to the trunk, it goes either to the right or the left because you have two lungs. And of course, please know that this is one of the exceptions, right? That is going to be what? This is going to be left pulmonary what? No, this is the trunk. What is this? What do you have here, guys? I mean, even the picture tells you. That's your lung. So we're going to call it right pulmonary artery because it's taking blood away from the heart. I know it's blue, but still we call it an artery. So one to the right, one to the left. So again, once blood gets oxygenated, right, out the lungs, what's going to happen? Well, the blood is going to come back. Again, we said that high CO2 is going to move to a place that you have what? Low CO2. And as the air comes in, high oxygen is going to move to the blood, which have what? Low oxygen content, right? Now your blood is oxygenated and returns back on the left side of the heart. Means what? The left atrium. What are those blood vessels? They're called pulmonary veins. Why veins? Because blood is returning to the heart. Everybody got it? So as blood enters here, the atrium gets filled. As that fills, now you open up the next valve. What is the next valve? The AB valve? On the left side? Bicuspid or mitral valve. And as that goes in, the ventricles fill with blood. And this, what do we call this? The filling of both ventricles with blood. What do we call it? Well, it enters into a diastole, but what do we call this filling of the blood in both ventricles? We call that isovolumetric relaxation. And that's the event that happens physiologically during what? Diastole. Everybody got it? So, what's next? Well, contraction comes in, right? Systole. What happens during systole? Both ventricles do what? Go through a phase known as isovolumetric contraction. So your heart now is moving what? Your heart now it's getting smaller, correct? So we call that isovolumetric contraction. That's the process of your systole. As that happens, again, blood is going to move down to the aorta, out of the rest of the systemic circulation. And at the same time, what is happening? Blood is moving to the pulmonary. Because again, blood leaves the heart whenever it goes through systole. Blood enters the ventricles whenever it goes into diastole. So you understand that part. So don't focus only on the left, but also on the right. Okay? So if there is a damage on the pulmonary valve, where's blood going to move? So if there's a damage to the pulmonic valve right here, where's blood going to move? Backwards. Does that make sense? Back to where it came, the right ventricle. If there's a damage to the aortic valve, where's blood going to move? Backwards. Back to the left ventricle, that's where it came from. Is that normal? No, that's backward flow of blood, right? We call this a what? What are you supposed to hear when you auscultate your patient? You're supposed to hear a murmur. Again, that's a normal heart sound. So that's the pathway of blood. We talked about that already. Make sure you guys go over it, okay? That is part of your exam. You need to put that into in a multiple choice selection. So the heart, we said that is located inside the thoracic cavity. It is above the diaphragm. It's actually in the middle of the chest, right? So we call this area right here, what do we call that area? The area where the heart is located. We call it the mediastinum. Mediastinum. In that area, you can definitely see here now that you have what? This thing right here, what do we call it? What is this right here, guys? What is this layer? We went over already, come on. That is neither the epi nor the endo. That is your visceral. And think about this. The layers of the heart are the following: endo, myo, and epi. On top of that, what do you have? Your visceral and your parietal. Everybody got that? So that what you're seeing here is your visceral layer. What do you see here? Like this space. What's the name of this space? What's the name of this space, guys? Pericardial space. What is the outer layer here? Your parietal pericardium. So far, it's good? Now, what prevents the heart from damage is the fluid in this space right here. So that fluid right there is known as what? Pericardial fluid. Why does it prevent that from being damaged? If you think about it, do you see there's a lot of space in there? There's not a lot of space, right? So every time the heart relaxes, this space right here disappears. So that fluid prevents it from friction. If you were to create friction with your hands, do it for about 5 minutes, and you see how much damage would that be. Like, do it for a minute only, and you see it's getting warmer and warmer. Imagine, does your heart ever stops? Most likely not, right? It stops for 250 milliseconds, but who's counting, right? That's not even a second. So all the time. So if your heart were to have no fluid at all, then your heart definitely will get some sort of abrasion, right? So get some sort of damage. So that's what prevents it from happening. How much fluid are you supposed to have in there? Somewhere around what? 25 milliliters, 25 cc's, right? ml. 1 ml is equal to 1 cc. If you didn't know, now you do. This is what you really need to know. If you go to medical, right, and in health field, that's like the butter and bread. So that's not at all, right? That's not a lot. So that means whenever that space is filled with something known as a blood, pus, or serous fluid, right, or too much of these, too much of that pericardial fluid, we call that what? We call that cardiac tamponade. What is a cardiac tamponade? It creates a tampon. What do we use the tampons for? To prevent things from coming out, right? So whatever it is from the tampon in, it's accumulating and becoming more pressurized. Do you all agree? Once you remove the tampon, then things will become less amount of volume because the volume is released out, right? The whatever blood or fluid is going to go out, the pressure is going to decrease as well. So far, so good. You guys understand that part, right? The same thing happens with the heart. Whenever you have too much fluid accumulation, can the heart dilate? No, because there is fluid that is pressing against that heart. So the heart won't be enabled to do what? To get filled with blood. So you decrease the diastole. Clear? Okay. So again, that's accumulation of fluid, right? So you decrease the ventricular filling. How do you do this? Well, how do you treat it? You do a pericardiocentesis, right? Straightforward. So normally you insert a needle, right, on the xiphoid process towards the left side, and you try to leave a little air gap. Once you get into cavity, then that needle is going to get filled with pericardial fluid, or fluid, blood, pus, whatever it is in there. Okay. So that amount of fluid, right, creates what we know already as a cardiac tamponade. What is a tamponade? Straightforward. Is the accumulation of blood or pus or serous that is compressing against your heart. So your heart will be able to go into diastole. That means that all the blood that is trying to get in here, what's happening to that blood? Can the blood get in? No. That means that the blood is going to start to do what? Accumulate on both the bottom and on the top. Why? Because there's too much pressure in there. So what normally happens to these type of individuals? They have venous distension. That means the venous, the blood vessels, the veins are going to be what? Dilated. Especially the jugular veins. Where is the jugular vein? Or most likely around your neck, right? The common jugular vein. So you're going to have something known as jugular venous distension. What else is going to happen to their blood pressure? Low blood pressure. Why is that? because there's so much blood around but not inside the heart that when the heart tries to beat that or push the blood out, it's really minimum amount of blood, so it cannot generate as much pressure as needed. So that person will become hypertensive, right? Or hypertension. So far so good? Now, if you were to auscultate, right? If you were to put the stethoscope in the chest of a patient and listen to the heart, where can you listen best to things? Directly to it or across water? You think? In this case, it will be across the blood. Normally, the best thing to do it is directly into the object. The best thing is directly into the object. If you put anything in between you and the object, what's going to happen to the sound? It's going to distort the sound. The sound is going to sound farther away. Why? Because you are farther away. That means this is known as muffled. What is muffled? A distant heart sound. Okay? A distorted. So far, it's good? Okay. So you can see here that, look, normally this is the space. This is a sonography, right? This is the normal space of your pericardium. You see how big this thing is here? Do you guys see that? That's a lot of space in there. So that tells you, that corroborates you that that is what is in there. There's a lot of fluid around the heart. So that tells you that most likely this patient is suffering from a cardiac tamponade. So after you see all these signs and you get this, now you have proof, right? From the signs and as well as imaging that tells you that your patient is on the what? Cardiac tamponade. Now, understand this. In medicine, if your patient is crashing, you feel no pulse, right? And you suspect cardiac tamponade, you're not going to send your patient to do a sonography. Because how long does it take to do a sono on a patient or a CT scan? At least 15 minutes. And that 15 minutes is life or death. So if you find all those three things and you're sure of what you do, you send it to the OR, right? Or you actually perform the procedure. Is that clear? Because the life is the best thing, right? That's what we're there for. Okay, awesome. So please don't mix it up with tension pneumothorax. What is a tension pneumothorax? If you ever heard, actually, no, never talked about this. So a tension pneumothorax is the thorax cavity. There is so much air in between the lungs, not inside the lungs, but in between the lungs, that is compressing the lungs and collapsing your lungs. That means that your lungs cannot get filled with air because there's too much air on the outside of the lungs. So your patient will have hypotension. See, same thing. Jugular venous distension because there's so much pressure of air in there. And the main thing is this: absence of heart sounds. So whenever you think that your patient has a cardiac tamponade, what are you going to do? Just listen to not to the heart, to the lungs. You're going to listen to the lungs. If you hear no lung sound, no breathing sound, that tells you that is a what? That a tension pneumothorax. If not, then most likely it's a cardiac tamponade. You get it? So that's what we're here for. I'm not going to go into any other details, right? This is just the x-ray, but I'm not going to go into any other details. So that's the application of what we learned. Now, here you can see that the whole thing here is called the mediastinum, right? Now, in that mediastinum, you have structures that are going to be on the anterior, middle, or posterior. Again, your heart is on the middle mediastinum. And that's where you perform the pericardiocentesis. You perform it right here, right underneath the xiphoid appendage, right, with a needle somewhere around 20 to 18 gauge needle.